Hello friends, today we'll discuss about coding guidelines for ultrasound pregnancy CPT codes which are used in radiology facility by medical coders. So let us check few of them. Now pregnancy CPT codes, most commonly codes are 76801, 76802, 76805 and 76810. 76801 is for first trimester when an ultrasound OB done for pregnant uterus and for fetal and maternal evaluation. For transabdominal approach is used for single or first gestation. So in this in this exam they determine the number of fetus, the gestational sacs, and they take their measurements, surveying the visible fetal and placental structure, assessing amniotic fluid or volume and sac shapes, and examining the maternal uterus and adenoids. So in CPT code 76801 you will see all these things documented in the medical report, and this is done for first trimester, that is less than 14 weeks. For each additional gestation you will use the code 76802. Now 76805 again, it is an ultrasound pregnant uterus real time ultrasound with image documentation for fetal and maternal evaluation, but it is done in after the first trimester, that is second trimester or third trimester. So here obviously this is done in second and third trimester, means the baby growth will be more, and you can see them all the elements like growth of the baby and many things will be visual in the second and third trimester. So here you can see this includes the determination of number of fetus, amniotic and chronic sacs, taking measure appropriate for gestational age, surveying intracranial, spinal, abdominal, heart chamber anatomy, as well as the insertional sites of the umbilical cord and the location of the placenta, and accessing amniotic fluid and maternal adenoids. So I can see compared to 76801 here more elements are visible since the baby's growth is more in the second and third trimester. Now 76810 again an additional code used along with 76805 for each additional gestation. So it's an add-on code, it should be used only along with 76805. 76811, it's a detailed examination of fetal anatomic examination compared to 76805. Very uncommon CPT code, we find very uncommon, but in coding it is very important because you have to check the medical report properly for coding this detailed examination code 76811. So in this examination you can see this includes the determining the number of fetus, amniotic, chronic sac, taking measurement appropriate for a gestational age, and surveying intracranial, spinal, abdominal, heart chamber anatomy. So till here if you see it is 76805, but plus a detailed evaluation of brain and ventricles, face and heart and outflow tracts, chest, abdominal organs and number, length and structure of the limbs, assessing amniotic fluid, maternal adnex and other any fetal anatomy is also done with a detailed evaluation of umbilical cord and the placenta. So in this 76811 very detailed examination is done through transabdominal approach. So this code should be used only when all these elements are documented in the medical report. 76812 again, and in each additional gestation you will use the code 76812 along with 76811. 76815 is unlimited ultrasound pregnant uterus exam. It is used only for the assessment of one of the following, like for fetal heartbeat, placental location, fetal position, or qualitative amniotic fluid volume for one or more fetus. Here the more important thing is it is used for one or more fetus. So if it's done for multiple fetus also, you have to use only one code because it clearly says one or more fetus. Do not use multiple codes when there are multiple fetus or gestation, because as per the code description you can use for multiple fetus only one code 76815. Coming to follow up ultrasound pregnant uterus code 76816. Here evaluation of fetal size by measuring standard growth parameters and amniotic fluid, evaluation of organ system suspected or confirmed to be abnormal of the previous scan through the transabdominal approach for a fetus. So only for follow up exam ultrasound pregnant uterus you can use 76816 for per fetus. So if multiple fetus, if it is there, you have to use the multiple code 76816 and you have to give 59 modifier for each additional fetus. because and if you see in limited ultrasound pregnant code, it is for one or more fetus we are giving only one code, but in some follow-up code you have to give multiple codes for each additional gestation, and you have to give 59 modifier for the additional CPT code. This is a very important confusion among medical coders, so please note down this while you're using multiple CPT codes, and avoid using 59 modifier when it is not required. Now 7681 says 17 ultrasound pregnant uterus for real time with ultra image documentation transvaginal. This is a straightforward code, and it is not having any confusion for using in OB charts for radiology medical coders. Hope you have cleared your confusion for coding the ultrasound OB CPT codes for pregnant uterus for first, second, and third trimester. So this is our sample report coded. So CPT code 76805. Here you can see I highlighted all these elements which are documented in medical report. For neuro, everything is documented, like 4-chamber anatomy, for GI structures, gastrointestinal, spinal, 4 extremities, everything is documented for coding CPT code 76805. Hence we have this report purely supports and clearly supports the CPT code 76805 also, or second trimester. As per LMP it is 20 weeks, so it is second trimester exam, and all the elements are documented, hence we have coded it as 76805. So if you I hope you have cleared your confusion regarding coding all these CPT codes, OB CPT codes. If you like the video, do share it, and if you have any confusion, do give your feedback in the comment section, and please do subscribe to my channel to get all the updates related to medical coding in future. Thank you.